there's some thoughtfulness that goes into that patient experience, right? That tries to get to those things, Jeff, that you're talking about, is just creating a culture where that just becomes the norm, right? I hear all the time patients who, so Southern Maine this time of year, July and August, we're a tourist place, right? So our volumes in our emergency department and my walk-ins, they quadruple, double, quadruple, depending. And so people who come from New York or Connecticut or Rhode Island or Massachusetts or whatever, they vacation up here and they walk out like, wow, this place is different. This was great. Like, well, we don't get health, I'm sure they get great care wherever they are, but it's the other part of that, right? It's the experience.
Yeah. So how do you support the culture of that? How do you guys approach supporting the culture and building the team members up in that space? How do you support that?
Yeah, it comes with a lot of communication, comes with a lot of touch points, right? It comes with a lot of feedback, and it's an investment. It's an investment. And the challenge with that, as you guys know, right, is trying to find balance in that. Because at the end of the day, right, we work in a system that requires volume. It requires productivity, right? All of those things that sometimes go see another patient, right? Or whatever. So that becomes the delicate dance. Without a margin, there's not a mission, I think is the expression, and that type of thing. So those become some of the challenges. And I think it's been getting a little bit harder and harder as reimbursement models change and become more difficult and trying to figure it all out. But so I'll give you an example. My service line, we run urgent cares. And if you look at the retail space, the for-profit urgent cares that exist in our communities or in our region, those providers are working in situations where they're seeing much higher volumes. They're working by themselves. They barely have time to take a lunch, like all of those type of things. We've worked really hard to create work environments that hit some productivity, metrics, but without just exploiting or taking advantage of those metrics. In other words, I have an easier time recruiting often because of how we set up our systems, and to improve the patient experience too, right? You don't want to come to an urgent care and have to wait 2 hours to be seen because the staffing is bare bones and they're really struggling. So to answer your question, it comes from finding the sweet spot to how you operationalize your clinics. How do you remain productive without getting so strict on those productivity that you increase wait time or decrease the patient experience? So all of those things, I think, come into play.